And this is especially true for people who've had neurologic injuries. And this is actually true for anyone. Even if you have not had a neurologic injury, I can, for instance, I can make you in experimental conditions, I can make you do math problems or do something cognitively demanding, and your motor performance breaks down, which is very, very interesting. I think what you're experiencing is a little version of that.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
I'm just going to take a brief detour to explore this. So one way to think about this, has anyone actually talked to you about this at all? Why that's the case?
Oh, no, actually, like nobody even, I'm doing
Yeah.
this all.
Okay, I got you. Yeah. Well, so I can give you kind of an analogy. So when you think about the way the nervous system works, this is going to be an oversimplification. So if there's any, I'm a fundamental neuroscientist when it comes down to it, and so I'll apologize for those very, very well informed people for this analogy, but I think it's very, very explanatory. You can kind of imagine the nervous system operating with certain limits. And with respect to doing motor tasks, doing something like, walking, for instance, it takes a certain amount of bandwidth, like memory capacity to do that. And let's say Chelsea pre-AVM, it probably took you very, very little sensory nervous system or motor nervous system effort, very, very low bandwidth activity, right? You spent the better part of your early life and then developing those skills. They became very, very conserved. You're able to do it under a variety of conditions, I imagine, whether it was dark out, light out, rainy out, whatever it was. You'd be able to walk reliably. You say, hey, right foot forward, go, left foot forward, go, right? It just worked. So very, very low bandwidth activity. But what happens is after a neurologic injury, the demands, not only because of the direct injury, the kind of perturbation, the loss of function in the network of neurons that normally controls that, but also because of this sort of, I'm going to call them network effects, because when you perturb something, it causes some indirect things going on. So you've got direct and indirect effects that are making that task much more complex. And it can be tenfold, 100-fold more complex, for instance. And when you find yourself, in a very, very simple environment, you're able to execute those tasks. But when you increase the complexity of your environment or you increase the cognitive load of something, that can really make our motor functions break down. And this is especially true for people who've had neurologic injuries. And this is actually true for anyone. Even if you have not had a neurologic injury, for instance, I can make you in experimental conditions, I can make you do math problems or do something cognitively demanding, and your motor performance breaks down, which is very, very interesting. I think what you're experiencing is a little version of that.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
Where when your environment gets very, very complex, or you get maybe anxious about people's perceptions of you, that kind of puts some cognitive load on you, and it's going to make your capacity to do those motor tasks that are already kind of at or near the limit that you have, it's going to kind of make it go over the edge a little bit. So that's a very, very expected thing to have. And we call this in the scientific literature, we can do dual tasking. And so the limits of dual tasking really go down when we have a neurologic injury. And so very, 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 very expected situation that you find yourself in.
I kind of that, like, because if there's a loud noise or something, like my arm will jump.
Mm-hmm.
Reminds me of a baby that, newborn baby, a loud noise.
Yep.
But it reminds me too, taking me back to where, I got to retrain over again, only 10 times more.
Yeah. And Chelsea, actually what you're describing there is in a different situation entirely. So you've got that dual tasking thing, which is happening, okay, where the cognitive demand can be very high for a given task compared to where it was before for you. And what you're describing now is the reemergence of these reflex patterns. then those those two things can convolve, right? Where you can actually have, for instance, if you're in a busy environment, you hear a loud noise, you might get some increased tone, which makes that whole kind of thing kind of fall apart. But yeah, that sort of concept of that flexure tone, or that in the lower extremity cases, the extensor tone kicking in, those can be very receptive or highly sensitive to external stimuli, because they're safety features, right? All of those withdrawal reflexes that you're describing in your upper extremity are safety things. And when you get startled, you want to protect yourself, right? So it's a very, very, basal thing that the nervous system does. And that's just re-emerging because of the injury. So very, 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 very expected. I know we've deviated slightly from, I think, our original conversation about these things. But I think, to your original point, I'll try to bring the ship back into your original question. Are you a good candidate for this? I'm not going to be able to say with 100% certainty that any individual person looking at me or talking with me is going to say, yeah, you're going to benefit from it, and you're going to see this much gains over this amount of time frame. It's not the way science works, unfortunately. I would love to be able to do that. I'd love for my crystal ball to be perfect, but I can't do that. My crystal ball is unfortunately fairly cloudy. But I would say, based on what you're describing to me, your time since injury, your relatively young age, these other factors are fairly positive when it comes to a responsiveness to these interventions. And the fact that you've already had some reasonably good return of function of your upper extremity, being able to actually control it, you don't have a whole lot of subluxation going on there, you seem to be motivated to do it, which is all of those are really, really positive factors, I'd say. Hopefully that provides some insight there.
Yes, I've watched several videos, and
yeah,
I've nothing but good results. I actually came across the girl on TikTok, Megan Beth, and she has the same thing I did, only hers left side, and she posts the video, and I was like, hey, I need to look into that.
Yeah, and I have I've worked with a number of people who've had a stroke, CVA, secondary to AVM. And for me personally, we think about the disease process, the consequences of stroke, where there is a portion of the cortex, let's just call it the central nervous system, that has had a lack of blood flow and has had tissue damage secondary to that response. And upstream of that could very well be an AVM, where you've had a rupture somewhere and anything downstream isn't getting blood flow. And it's not being able to get oxygen, not be able to get glucose, et cetera, et cetera. Simultaneously, you could also have a clot, right? Those are two completely different, quote unquote, disease processes, right? But many of the downstream consequences are indistinguishable. And the way we would treat them in the neuro-rehab world would be very, very similar. And I think, we might take, certain cautions of people who have had AVMs, mainly because of the secondary bleed risks, et cetera, et cetera. But those are factors that we can incorporate. But fundamentally, the interventions would be largely conserved across them. And so I don't see a reason why you or anyone with an AVM would be uniquely excluded from these interventions. We just have to treat them, treat you as a unique person, factor in all of those very unique factors that you bring to the table with that intervention going forward. So, yeah.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.